Cerebrovascular disease. Basic principles. Neurologic deficit due to cerebrovascular compromise. Major cause of morbidity and mortality. Due to ischemia, 85% of cases, or hemorrhage, 15% of cases. Neurons are dependent on serum glucose as an essential energy source and are particularly susceptible to ischemia. Undergo necrosis within 3 to 5 minutes. Global cerebral ischemia. Global ischemia to the brain. Major etiologies: number 1, low perfusion, for example, atherosclerosis. Number 2, acute decrease in blood flow, for example, cardiogenic shock. Number 3, chronic hypoxia, for example, anemia. Number 4, repeated episodes of hypoglycemia, for example, insulinoma. Clinical features are based on duration and magnitude of the insult. Mild global ischemia results in transient confusion with prompt recovery. Severe global ischemia results in diffuse necrosis. Survival leads to a vegetative state. Moderate global ischemia leads to infarcts in watershed areas. For example, area lying between regions fed by anterior and middle cerebral artery, and damage to highly vulnerable regions such as pyramidal neurons of the cerebral cortex, layers 3, 5, and 6. Leads to laminar necrosis. Pyramidal neurons of the hippocampus. Temporal lobe, important in long-term memory. Purkinje layer of the cerebellum, integrates sensory perception with motor control. Ischemic stroke, regional ischemia to the brain that results in focal neurologic deficits lasting more than 24 hours. If symptoms last less than 24 hours, the event is termed as transient ischemic attack. Subtypes include thrombotic, embolic, and lacunar strokes. Thrombotic stroke is due to rupture of an atherosclerotic plaque. Atherosclerosis usually develops at branch points. For example, bifurcation of internal carotid and middle cerebral artery in the circle of Willis results in a pale infarct at the periphery of the cortex. Embolic stroke is due to thromboemboli. Most common source of emboli is the left side of the heart. For example, atrial fibrillation usually involves the middle cerebral artery, results in a hemorrhagic infarct at the periphery of the cortex. Lacunar stroke occurs secondary to hyaline atherosclerosis, a complication of hypertension. Most commonly involves lenticulostriate vessels, resulting in small cystic areas of infarction. Involvement of the internal capsule leads to a pure motor